Hello everyone, good day. Today we are going to be discussing about the 14 common questions patients usually ask about COPD, especially patients suffering from the disorder. First of all, as you are seeing these two images, the first one is demonstrating a healthy lung tissue, while the second one is demonstrating the lung that is already been damaged by the COPD. As you are seeing, is even darker than the healthy lung. So the first question being asked was, what is COPD and how is it different from asthma? I will try as much as possible to be explaining in a layman language, not in a medical language. I will try as much as possible to reduce or to minimize usage of medical jargons. So chronic obstructive pulmonary disease can be defined as a long term. This is the mark, the keyword here. Long term lung disease that makes it hard to breathe in such a way that the lungs become so narrow or the airways become so narrow to the extent that someone may be having a difficulty in breathing in and breathing out of the lung easily. uh, while asthma can be defined as an intermittent. When we say intermittent, we mean something that used to come and go. The symptoms are not usually constant, while symptoms of COPD are almost always constant, while symptoms of asthma are coming and be going. They used to come at a particular time, especially after the patient has been exposed to a certain precipitant that may precipitate the symptoms. While COPD, the symptoms are there even without any precipitant. So this precipitant, and usually the asthma usually used to start from childhood, is diagnosed at the beginning of especially in the early life, let's say the age of 10, the age of 12, while COPD is usually, if not all the cases, are diagnosed in adult, especially around 40, 40 something, 50, because someone has to spend years smoking before he developed this kind of COPD. So this COPD is not a single entity of disorder. It's actually comprises of three different disorders. First disorder, someone may have chronic bronchitis, which is the most common cause of which is the most common type of COPD. Number two, or emphysema, the second. Then third, bronchiectasis. So that means COPD is an umbrella term referring to this. If someone is suffering from chronic bronchitis, we can say you can say he's suffering from COPD. If someone is suffering from emphysema or bronchiectasis, so that person you can refer to him as suffering from COPD. So that means COPD is an umbrella term for these three conditions. And usually, if not all cases, are caused by smoking, as we are going to see in a minute. So these are the causes. What are the main causes of COPD? That brought us to the second question. The main causes, number one cause, the number one culprit is cigarette smoking. This is the number one culprit. So then followed by air pollution, occupational dust, especially people that are dealing with smoke or dusty occupation, so they may end up having COPD. But the most common culprit is cigarette smoking, actually. So the third question is, what are the early signs and symptoms of COPD? So the most common symptoms that are experienced by patients with COPD is cough, especially if someone is having chronic bronchitis. The cough usually lasts for more than 3 months in 2 consecutive years. Yes, and that cough is productive. Unlike in asthma, the cough in asthma is not that productive. It's usually not having mucus, while the cough in chronic bronchitis or in COPD is actually having a lot of mucus, number one. And secondly, shortness of breath, especially when doing activities. And then at times someone will be having wheezing. Yes, that is whistling sound when breathing. But this one is also attributed to asthma, more common in asthma. So that is it. And then someone will be uh, having a kind of feeling tired easily. That is easy fatigability. So the fourth question is, how is COPD diagnosed? Actually, COPD are diagnosed by doctors from history. If the doctor or if the patient presented to a medical doctor with a history of having cough for months and with a background history of cigarette smoking or exposed to dusty environment for long period of time, especially when dealing with his occupation, so this will make the doctor to be suspicion of this COPD. And then listening to the chest with stethoscope can also help the doctor to make the diagnosis of COPD. And also, there is a test called a spirometry test. This spirometry test is also used to uh, confirm the diagnosis of COPD. At times, CT scan, especially in the case of bronchiectasis. So that's it. Then the fifth question is, can COPD be cured or it can only be managed? Actually, you cannot cure COPD completely, but it can be managed. And the gold standard management of COPD is cessation of smoking. If someone is smoking cigarette, as I have already mentioned, is the number one culprit of causing COPD. So no matter what type of drug you are placing a patient with COPD, he has to stop smoking cigarette for that management to be successful. Number one. And then number two, lifestyle modifications. Uh, Even especially in the diet, someone with COPD supposed to reduce intake of dairy product because anytime a patient take a dairy product, especially for example milk, in the body system, it's going to be releasing some kind of metabolite called casomorphin, and that casomorphin will increase in the production of mucus in the body, including the lungs. And don't forget, someone with COPD is having excessive amount of mucus in his lungs. So that casomorphin can also increase or aggravate his symptoms or the obstruction and eventually his symptoms. So let us see the sixth question. What are treatment options available for COPD? So treatment options, that is apart from the lifestyle modification and the cessation of smoking cigarette, inhalers, especially long-term inhalers or long-acting bronchoagonists like salmeterol, or like especially with when combined with steroid, that is plitocasone, or commonly the common formulation is serotype inhaler. So it is combination of steroid inhaler and steroid medical drug, and then the long-acting beta agonist that may help in the widening of the already narrowed uh, airway. And then what lifestyle changes can help manage COPD? As I have already said, stop taking dairy product or take it in a negligible amount, and then even exercise, especially walking. Walking can also help in cessation of symptoms. And then stop taking alcohol, stop taking cigarette smoking, quit smoking is the most important thing. Then number eight, how does smoking affect uh, COPD? Actually, smoking can affect uh, COPD patient, or smoking can cause COPD because long-term exposure of that lung to cigarette smoking can cause damage to the lining of the uh, airway. So if the airway is damaged, especially we have a kind of something called cilia. That cilia is found all over lining the airway, which help in sweeping mucus and bacteria that we inhaled. So chronic or long-term usage of cigarette smoking can damage those cilia. So that means if a person inhale dangerous or bacteria or anything or dust, the body cannot get rid out of that uh, harmful agent. So it will remain in the system. So remaining in the lungs will cause a chronic inflammation, which will cause eventually damage to the airway. So chronic damaging of that airway, together with the damage that has been caused by the cigarette smoking in itself, so can eventually cause that excessive mucus production, but the mucus cannot get rid out because the cilia has been damaged. So I'm eventually causing narrowing and breathlessness. So what medications are commonly prescribed? As I've already mentioned, serotype inhaler, and at times there are some medications called Montral. Montral is a combination of montelukast and levetiracetam. This medication also help in reducing uh, the, 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 the constriction together when contributed or when combined with the inhaler. So when is oxygen therapy actually needed in patient with COPD? Actually, patient with COPD may need oxygen because in some cases the patient the patient might have low level of oxygen in some cases in his system. But so the medical doctor or his doctor may prescribe to administer oxygen for him through the nasal tubes or face masks, as you are seeing in this image. This is a face mask actually. But administering oxygen to someone with COPD, even if there is indication, it has to be under caution because uh, unnecessary or too much oxygen administration to someone who is COPD patient may cause depression in the respiratory center, which may eventually worsen the patient's situation. So always ask your medical doctor in the oxygen in terms of oxygen administration. So what are the complications that may arise in someone with COPD? The first complication, even before I mention it, is you can guess that someone will have chronic infection in the lungs because anytime you inhale bacteria or dust particles, you cannot get rid out of them. You cannot get rid out of them. So because the cilia that's supposed to get rid out of the bacteria or the dust particles are actually damaged. So someone will be having chronic infection. So almost always, patient with COPD will be having chest infection. Almost always. Number one. Number two, someone will be having heart attack. The heart will be having difficulty in pumping the blood into the lungs. So someone will also have heart failure, which is called copulmonale, as a result of uh, uh, the COPD. So someone will be having weight loss because someone who has been having cough for a long period of time will be having weight loss definitely because of the chronic cough. So that is it. So how often should patients see uh, their doctor? So actually, this depend on uh, the your physician, and it depends also on how well controlled your symptoms are. So this actually is there is no specific period or time or interval time interval of visiting the medical your medical doctor. but it actually depends on how well your symptoms are being managed, and it depends on the stages. There are also stages of COPD. I didn't bring them here because uh, it is actually not for a layman actually, so that's why I didn't bring it here. So what exercise are safe for people with COPD? Yoga exercise, walking for 30 minutes every day or in the morning, especially if there is no dusty environment. If the environment is not dusty, you can walk along. So that is it. Then what is the life uh, expectancy of someone with COPD? Actually, actually, the life expectancy, it all depends on which stage the person is. For people that are in stage 3, or even stage 4, can live uh, like that. For example, 6 to 9 years, can live 6 to 9 years shorter than average. For example, if they are supposed to live, for example, for 20 years, so they might end up living for, let's say, 11 years. So they used to get 6 to 9 years shorter than the expected years for otherwise healthy man, someone who is not having COPD. So that's it. I hope this video is you find this video helpful, and I'm waiting for the questions for other diseases. Thank you very much.